Hi, everybody. It has been a while, I think again, since I have done a live video in the DPT to CEO Facebook group here. And I feel like I've just been really busy, all scattered for the past couple of months. Sure, a lot of people have, with the holidays and then starting the new year. But I've been wanting to do live videos again because I really like them and I like sharing information with you to help you with your practice, help you with your business that you are starting and growing. And I have had a few questions this week about keeping patients. And I wanted to share like the 3-step process that I use and the 3-step kind of like service menu that I like to use and like to promote other therapists use, at least to get started and kind of have an idea of how their services go. So I wanted to share that with you guys tonight. So for those of you who don't know me as well, my name's Morgan, and I own a cash therapy practice in Henderson, Nevada. I'm a physical therapist, and I have also spent the last couple of years working with other therapists and clinicians to help them grow their own cash practices as like solo businesses. So I'm the sole owner, operator, and physical therapist for my practice. And recently, my fiance Kyle has also been starting to see his options, which is really cool. And we currently work out of our garage gym, or we do stuff on as well. So that's a little bit of background about me. And I created the DPT to CEO program to help new practice owners get up and running and get at least their first 5 paying clients, if not more, in about 6 months. So if you are interested in any information on that program, go ahead and leave a comment down below. Without further ado, let's get into this 3-step process. So the 3 steps that we're going to be talking about today have to do with like service design is how I call it, pre-framing and setting expectations. And those two are like kind of similar. They go hand in hand, but I like to kind of talk about the differences between as well. So the very first thing that you will need in order to keep patients in your practice and keep patients coming back is a very clear offer, but also a clear step-by-step process that your patient or your client will be going through. And you need to be able to verbalize that and share like what it is and how it works, because people really like knowing what the plan is rather than having kind of like a vague understanding of how something could go. So what I do in my own practice and what I teach people as well is having 3 kind of components of your service menu, so to speak. There's always going to be an initial assessment, first visit, whether you're offering therapy or a different service. You're going to have your first visit every time, where you figure out, what the person in front of you is going through, what their history is, what their goals are, and what they're hoping to get out of their experience with you. So I'll call that evaluation. Even if you aren't like practicing therapy, maybe fitness coaching, like there's always going to be that initial visit to test things out and set a baseline that you can go off of. And then the second part is going to be the initial plan of care, which again is, a little bit like medical sounding, but it's just that initial kind of offer that you give to somebody. So, if somebody were to come to me with knee pain, I would have that initial visit with them, do the evaluation, and then I would offer them their initial plan of care. This is what it's going to look like. We're going to work together for 6 weeks, once a week. And by the end of those 6 weeks, here's where I expect to be. And this is where like the setting expectations part comes into play and the pre-framing, I always really like to make sure that somebody is clear on, now that we've done this, here's the next step, and here's what to expect at that next step. So then it's not a surprise. Everybody's on the same page and continue to work together smoothly. And I'll get into that more in a second. So we have service design. So initial visit, plan of care, and then maintenance is the third part. With maintenance, that can look like whatever you want it to look like, really. It could be the same maintenance program for everybody that you work with, or it could be a custom, like, kind of design for different people depending on what they have going on. And that all depends on like your personal preference, your schedule, and your business. But having that third option, so now that they've gone from point A to point B, having a point C can be really helpful for a couple of different reasons. Like I've had therapists tell me, like, oh, I had, this patient for 8 weeks and I discharged them today. So I need to go out and find a new patient. And while that could be very well true, maybe that person that you just worked with, like, really is totally good with like leaving and never coming back. I've found that about half, like at least half of the people that I've worked with, whether they are physical therapy clients or health coaching clients or my business coaching client, like about half of the people that I work with aren't really ready to like let go cold turkey. They still feel like they want to have a little bit of support in helping them maintain the gains that they have made. They want to have somebody to ask questions to. They want somebody to like just tell them to do their exercises. And that's where having like that third option can be really helpful, because one, like, it's continued cash flow for you as a business, which is always great, but even more important than that is it can really help with compliance and making the gains that you guys made together like stick for the long term. And we all know that here in this group, that like clinically that can be really important and really helpful. And so I always like to make that an option. And the worst thing that's going to happen is that somebody will say like, no thanks, Morgan, like really loved what we did so far, but like I feel like I can do this on my own now. And that is totally fine. So like to just kind of reiterate with like our, first kind of like segment of this video is you need to have a clear service design. Like you need to have a clear menu and a clear way that you are working with people, and like just step by step by step, like you should be able to explain it very clearly. And the three like pieces that I like to suggest and what I operate off of is having an initial evaluation is just, standalone by itself, and you charge for that initial like assessment, initial visit. And then at the end of that visit, you pitch or offer the initial plan of care, which is the second segment. And then at the end of the initial plan of care, maybe there's a secondary plan of care, or you offer that person the option to move into like a maintenance situation, whatever that might look like. And so you have those three steps, and all of a sudden it becomes like a very specific plan and kind of like outline and roadmap for the client that they might not have really experienced before. Or, if we had just said something like, okay, like you're going to come for this one visit and then we'll see what happens, that lack of clarity can be really hard for somebody to agree to. And most likely you're going to get the let me think about it, or, I need to talk to somebody about this, or I'm not really sure if I want to do that. So the more specific you are with things, the better off you guys are going to be. So service design, we need to have a clear service design. And then, like I mentioned before, the second and third things that are really important in order to have a successful workflow with that service design is to pre-frame people and set expectations. And like, I know I said this was a 3-step process, but 2 and 3 kind of go like hand in hand together, because like just pre-framing somebody and getting them like mentally ready to think about what the next step is, and then setting the expectation of what's going to happen. It's kind of like all one process. So to give you an example, I will typically have with, people I don't know, I will typically have a discovery call of some sort. Maybe it's a video call, maybe it's a phone call. One of my patients just like messaged me on Instagram, and we kind of did the discovery like phase of things there, where like you and the potential client talk and figure out like, what they're going through and if you are the right person to help them. And your only goal during that discovery session is to figure out if that person in front of you is an appropriate fit for the initial visit. You're just going from point A to point B right there. You don't need to worry about whether like they're a good candidate for an entire plan of care or any of the other services that you offer. It's just, do they qualify essentially to have an initial evaluation visit? And if they do, so on that discovery call, in my head, I'm like, check, like I can definitely help this person. I will offer them an opportunity to schedule that initial evaluation. And so say they say yes, then I say, okay, cool, so and so, I'm really looking forward to working with you on this. We'll go ahead and set up your initial assessment for next Tuesday at 3 or whatever it is. And during that session, here's what to expect. Here's what we are going to do. We are going to talk at length about your past medical history, get a sense of kind of like lifestyle factors right now for you, your overall like wellness, where things are at. I'm going to do a variety of different tests and movement analyses to take a look at what you have going on. And then together, you and I are going to come up with a plan to help you get where you want to go. Does that sound okay? And then that way, like, they going into that visit know exactly what to expect. So I will work on pre-framing them for that on the discovery call. And then I will also, most of the time, text them or email them and kind of reiterate what we had talked about as far as what to expect during that session. And then it just becomes really clear. And then the same thing will happen like at the end of the evaluation. You will do the same kind of thing for the plan of care. I want to work with you once a week for 6 weeks. During those 6 weeks, like, here's what we're going to do at each session. And by the end of the 6 weeks, here's where I expect us to be. Obviously including the information that like you're not you aren't able to see the future, but based on your experience with other patients and like research, here's where I expect us to be in 6 weeks. And at that point, if we're there, we can talk about what's next, or if we're not there, we'll also talk about what to do next. And that again continues to give people the clarity that they need to understand like what they're buying into and what they are investing their time into. And then throughout the initial plan of care, I will also make a point to check in with my clients about where they're at in the plan and what we're planning on doing next. So usually I will start talking to somebody about potentially doing maintenance stuff about halfway through the initial plan of care, and just, like pre-frame and let them know like, hey, you're doing really well. It seems like you're really responding to this stuff. And I just want to let you know that, about half of the clients that I work with, they will stay with me after this initial plan of care. And it becomes kind of a maintenance thing where we meet once a month, and in between visits, I provide you a program to work on. And then they'll say, cool. And you'll say, great. We'll talk about it more at the end, like on our 6th visit. And then like on, visit 5, probably in a 6 visit plan, I will remind them again, like, hey, next visit, that's our last one that we had planned on. At that point, we're going to reassess everything and see where we're at in relation to our goals. And we can always discuss like, what are the next best steps to go from there? And then they'll say, okay, cool. And what I really like about doing this is that it gives somebody the opportunity to kind of like wrap their mind around continuing to invest time and money into working with you, and like more importantly into fixing their problem, achieving their goals, and really like changing their life. You give somebody at least like a week to kind of wrap your mind around it, or wrap their mind around it, so that when it comes time for that discussion on the last visit, it's not a surprise. Like throughout the entire plan of care, you've already set the expectation that like by the 6th week, we should be about here. And I have options, whether we're there or not there, that we can talk about. And it creates an entire experience and relationship with your client that I feel anyway is like very trustworthy, very open and honest, clear. And that's a really good place to operate out of. So I'd love to hear from you guys if this is something that you are doing in your practice, in your business right now with your clients. If so, how it's going. Or if not, like, tell me a little bit more about what your workflow is. And if anything in this like little talk tonight stuck out to you. I'd love to hear what you guys have to say. If you have any questions, let me know. And my hope getting is to get back into doing these live videos once a week, because I think they can be helpful. With the different questions that my clients have, like in my business coaching program, like sharing a little bit more about what we discussed there, or even like questions that I've had as a practice owner, and like sharing the information that I find. Anyways, be on the lookout for more of these live videos. If you have any specific questions on anything, please leave a comment down below, and we will definitely get into it. So I hope you guys have a good rest of your night, a good weekend, and we will talk soon.